Hey everyone, what's up? This is Dr. Charlie PT. Hope you're doing well wherever you are. In this video, I want to share with you a conversation I had with a woman named Connie. Connie is a member of our Glute Relief Accelerator program, our private coaching program, basically where I teach you what you need to do to heal yourself. No pills, no shots, no surgery. All right, Connie was actually told that she needed spine surgery in 2012 because she was told that she had spondylolisthesis and spinal stenosis and all those good things which could not be corrected naturally. But they can. Now, did we correct them? Did we go in there and shave the bone and do any of that stuff? No, we did not. But we taught her how to use the power of her mind and movement as medicine to resolve her pain. So we chatted with her in early April, and she wasn't ready to commit at that point. She was skeptical about whether or not we could help her, number one, virtually. I'm in Pennsylvania. She's in Colorado. I never even chatted with her before this conversation that you're going to see in a minute. So how do we help her? We taught her. We taught her what she needed to do to resolve her problem. All right, but we chatted with her, and then 2 weeks later, she said, you know what, I really need help. Chiropractic's not working, motions aren't working, PT's not working, and I definitely don't want pill shots and or surgery, so can you help me out? Absolutely. We gave her access to the program, which has helped so many people with unresolved back, butt, and sciatica problems, and in a short 4 to 5 week time frame, she is back to walking, back to sleeping. Wasn't able to walk for 5 minutes, wasn't able to sleep barely at all, and she's doing everything she wants to do and more. And what's interesting is after that first, to give you an idea, after that first conversation in April, she shot me a message, again, with some of her concerns and her questions. And she said, hey, Dr. Charlie, I appreciate you considering me for the program. I think this is the direction I should go. I'm just doing some further research. Still on the fence, right? Per the MRI done in January of 2012, she's had this now for, I guess, what, 11 years, right? There is an anterior listhesis of L5 on S1 of 11 millimeters. There is severe bilateral foraminal stenosis with probable impingement of both L5 nerve roots. The back x-ray done a week ago shows severe lumbar degeneration per the doctor. Basically, I just need to do some more research. A lot was thrown at me. Question, knowing the above, Dr. Charlie, do you still believe that your program can eliminate the hip and leg pain, or at least get me to the point of being able to stand without the severe hip and leg pain so that I can continue to get my daily walks in? And she said, yes, I do. But that was my answer too. Yes, I do. Check out her feedback on the program and her experience. What's up, Connie?
Hey, Dr. Charlie, how are you?
Good. It's good to see you.
Good to see you too.
And it's good to actually meet you because I know that, like, I don't know, have I actually talked? I think I did. I've called you and, I think whatever, but I don't, since the program, I don't know if I've actually physically talked to you.
Nope, this is the first.
Cool,
Yeah,
cool.
it's been very, very good. I almost from the get-go, within, I would think, like 2 weeks, I was out walking and feeling pretty good about it. There was some pain, so it was a slow start. Yep. But I have worked up to, in the last couple of weeks, worked up to the 4 miles a day. Yeah. So I'm happy. I'm feeling pretty good.
Good. Awesome. Cool. Well, we got probably a little bit to go there, but I appreciate you sharing that. Now, let me ask, right? Because we can do this a couple ways, but I'm just going to, if it's cool, if I can just ask some random questions like feedback. And then also I want to just verify a couple things. I know you had some sticking points in the beginning, even before joining and stuff like that. So I think it's useful. Now, I mean, let's be honest, right? There's a lot to be skeptical about, right? And so it's just I know you probably had some skepticism, no doubt, in the beginning. And so I remember texting you on my mother-in-law's back porch because you were like, hey, I just want to do some research, right? And I was like, hey, is there anything I can help you do research on? And so I just can't tell you how many people that I'm like, I know we could help them, but how do I help them see that we could help them?
Yeah, you were very good about the videos that you sent, and they definitely helped to get me to that point of signing up. And yeah, for sure.
For somebody else who's like yourself, who has been told, okay, I got spinal stenosis and therefore I maybe need to do this. And they're really kind of maybe stuck on that in that diagnostic paradigm. You learned a little bit about untethering in the beginning of the program, right? And that is honestly the hardest thing for me to get people past, right? So when people reach out to me, they have kind of 2 barriers. Number one, they have a lot of that which they've been told by other providers. That's really difficult to overcome because there's so many kind of greater authority figures in the hierarchy of healthcare, right, that have told you and probably proved via an X-ray or an MRI or something like that, that you have this thing and therefore we're going to recommend this or that. pretty much all the time, it doesn't include the recommendation of an online virtual program where somebody can teach you how to resolve your pain.
Correct. Yep. Right. You're right. Yeah. I was to the thought that I had something physically wrong going on here. And with a test that were taken, I had a back x-ray that I was in the process of getting results for when I contacted you. And I wanted to know what those were.
What were you told was wrong with you diagnostically? If you can give specifics, that's cool. If you'd rather not, that's fine too. But I think some spinal stenosis, like you said, and arthritis was in there. So what were you told was diagnostically kind of quote unquote wrong with you? And what were the recommendations?
Basically, a lot of back pain with the stenosis and arthritis and pinched, herniated discs. And I was told that basically the discs being degenerating. Yep. And they said 10 years ago that they recommended surgery. And I knew then, and as I am still under that same belief that I didn't want to go that route. Mm-hmm. No surgery to relieve the pinched nerve. They said it was a pinched nerve.
Okay. And what did they recommend this time around? So 10 years ago, they said, hey, you need some surgery. And then what did they say this time?
Well, I think even before they could go to the surgery, I told them that wasn't an option. Okay. That I wasn't going to go there, but that's kind of the direction they were going.
Okay. So they were going down the more traditional medical approach would be, you know, the shots, the pills, the surgery, all of that stuff.
Yeah. Physical therapy. They actually recommended when I said no surgery, then they recommended physical therapy.
Yep. Totally. Got it. And how did you discover us, right? Like, what did that look like? How did you discover me?
When I started having this pain, I went on the internet and I came across your YouTube videos and I watched one after another. I mean, it was just, what can I do? What can I do to relieve this? And I, like you, believe that I could do it naturally, without the pills, without the surgery. Yes.
Cool.
Without injections. Yes.
That's great because may sound strange, but the number one predictor of whether or not something will work for you is whether or not you have a belief that it will work.
I agree.
So, you know, we've done some studies where we look at, hey, who are the people who respond to getting their back cracked? It's the people who believe that getting their back cracked is what they need, right? Mm-hmm. And so higher level than that, it's like the number one predictor of whether or not people will get better, right, is whether or not they believe that they can get better naturally. And in this case, you had to have a belief that you could get better, not on your own, but being given the tools, knowledge, support, right, and things that you need. Because where do you live, by the way?
I live in Colorado.
Okay, I'm in Pennsylvania. Okay, and so we're a little far away, right? And so you had to have that belief. And I don't know what stopped you initially, but like you chatted with us originally, right? And then it was like, I reached out to you after the call because you decided not to move forward at that time with the program, right? And I said, hey, like, how'd the call go? Do you have any questions? And like, what was the sticking point there? Because then eventually, I think it was like maybe a month later, I don't know how long it took for you to join the program, but where was the sticking point for you and what was stopping you?
Doing this online. Yeah. And then the money came into play too. I'm like, okay. And the trust of being able to do this with somebody that I haven't seen actually physically. Yeah. It was getting to that mindset that, could I make this work?
It sounds like you needed validation on a couple kind of levels, right? You needed validation on number one, on the belief side of things of like, you knew you could naturally solve this. It sounded like that was the best way to go. So you shut down the surgery route and things like that. But then it was like, okay, there's this hands-on approach, right? Which is I could go down the street and do that, right? Or there's this virtual thing. I'm not so sure how this whole virtual thing works out, right? So that sounds like it was one sticking point, right? So can you just go a little bit deeper on like, how did it work out? Meaning, was it something where you're like, oh my gosh, this is so complicated and like I had no idea what I was doing and Charlie wasn't helpful? Like, did I strand you? What happened?
No, it was, you were helpful. right from the beginning.
And then when you got into program, right, was it something you were like, oh my gosh, this is so clunky and I'm just lost, and like, or do you feel like you were able to see the process and work through it and get the result that you wanted?
You know, maybe at first I was like, oh, I just want to know what movement can I do to alleviate this pain. But as I have gone through your phases, I have gained that knowledge of your program that's given me the power to understand where this pain is coming from and look at it differently. And
cool.
It just, the information that I have gained from your program, that's huge. That's huge. That did it for me. I mean, it was, you know, realizing, I mean, one of the questions that you had on your application was, was there a life event that occurred?
Yep.
That maybe, you know, could have started this. And it was, my husband had a fall on the ice, and I was dealing with his pain, which was intense, and going to doctors and trying to figure that out and how are we going to do our work that we need to do. And it got to me. The stress got to me. So I knew that was huge. And as reading through, going through your phase 1, I realized that I could work out of this.
Yep.
And I was convinced in my mind, I was convinced that I could do that.
Yeah. Interesting. Okay. So just to be clear, right? We all have preconceived notions about what we need or what we think, right? And so you had this preconceived notion, like a lot of people do, right? I can't tell you how many times I chat with people and they're like, just tell me the exercise.
Yeah.
And it's like, you have to understand there's a little bit more involved in this. And as much as, you know, you see YouTube videos that are like, I just saw one actually, stop hip pain, the one stretch, right? It's like, to me, that's too clickbaity. I don't like that stuff, right? And I'm sure the channel could be bigger if I put more clickbaity stuff out, but like, people need to understand it goes deeper than that. Like, if you're really going to create a permanent change in resolving this, you have to understand what pain is. You have to understand the origin of pain. You have to understand, yes, motion, but really what you're doing with motion. It's not all about fixing stenosis or arthritis or whatever. It's so much deeper. Does that resonate with you?
Yep. 100%.
In the beginning, the first thing I start with, right, is helping people understand the role of the mind on pain. So your body is the instrument of the mind. All right. Most people think it's the other way around, right? Like, but all of your thoughts are what inform your physical actions, right? And so we talk about the origins of pain, and we essentially help you reprogram it with the tools and the resources and kind of the phases or whatnot. And it sounds like, as much as you came into it with like, I just want this one exercise and get out of here, like, you actually gained way more than that.
Yes. Oh, definitely. Yeah. The knowledge that I'm gaining from your program has really, I think, pushed me forward quickly through recovering. And I'd have to say right now, I'm probably at like a 85%, 85 to 90%.
Yep.
I still have a little bit of that pain in my, I'm going to say my thigh.
Yep.
That bothers me. Otherwise, I can walk pain-free.
Yep.
And I'll have that pain in my thigh every now and then. I can deal with it. It's not the excruciating pain, it's the dull pain now. And at nighttime, I can sleep. When I first got into your program, I couldn't do that. I couldn't sleep at night. I couldn't, it was all consuming. It was like, will I ever be able to go out and get my walk in? You know, that turns things around for me. It makes me feel so much better.
So it sounds like one of the big kind of, you know, feelings and or things that you've recognized as you've gone through it is you've gained a lot of like empowerment.
Absolutely.
Right?
Absolutely. Yes.
Yeah. And one thing I sensed, because I remember when you initially didn't sign up the program and I reached out to you, you know, I was trying to just kind of understand what happened there, because I knew I could help you, right? After reviewing the case, I was like, Connie, I know I could help, right? But there was a little bit of a barrier there is, you know, you were stuck, right? From this place of, you weren't in a place necessarily self-empowerment, feeling like you had the control. It was like, hey, I've got this external thing this X-ray, this MRI telling me, labeling me with this thing. And because of that, I feel like, because I know you asked me, you said, can you fix stenosis?
Right, right.
And so it was like you were looking for something to fix that which existed, yes, inside of you, but almost outside of you on this thing, and then making calls based off of that versus really being able to tune into your body and feeling empowered to solve this with the tools that you had, your body and your mind.
It's there. I realize it. I mean, I'm 68 years old, and I know that over time, over these past 10 years, things have gotten a little bit worse as far as arthritis, but I tried to stave it off with trying to keep healthy and getting out and doing the walking and what. So as I was gaining the knowledge through your program, I was like, okay, all right, it's there, but I can deal with it.
Yep. And here's the thing, right? I know, how many weeks are you in a program? Probably like, are you a little over a month now? 6 weeks?
Yeah.
Where are you at?
Yes. So the 3rd of June was my 4 weeks. So I've got a couple more weeks, or a week or so.
And how long have you been dealing with back problems just in general? Like, how far does this go back?
It goes back about a good 10 years, 10, 11 years. I'm open to doing this the natural way. And it has worked 100% for me.
Cool. Yeah. And there's still a little bit of way to go, but here's what's cool.
A little bit.
You know what you have to do, right? And obviously there's still support there, but like the goal is, if you have my brain and you know what I know, right, you can start to think more like me. And so you can continue to make decisions that you know are going to be valuable for you moving forward, and you're going to get there. So that is awesome. So just 4 weeks in and able to sleep, able to walk, do things like that again, which is cool. Question about that maybe a little bit more is, do you feel as though you being stuck in that diagnostic mode, do you feel as though that stalled things for you? And do you feel like you really needed that? Right?
Probably not. No, you're absolutely right. Did I need it? No, yeah. I didn't because it didn't matter what it was going to show me. If there was something definitive about what maybe they came up with as far as the results on the back X-ray, okay, maybe that was, going to calm my mind a little bit, but it didn't, it was the same, maybe a little worse than where I was 10 years ago. You said you could help me fix it.
Yeah.
That was huge. And, going through your program and
the mind side of things, essentially teaching your body to view what you're experiencing through a lens of safety versus threat, reprogramming your reaction to pain.
Exactly.
Yeah. Really cool. And the reason I asked that, right, is just because, again, there's a lot of barriers when it comes to trying to help people who are in pain. And one of them is absolutely this: I need to figure out exactly what's going on, because if I don't know that, Charlie, how can you possibly help me? All right. So now you mentioned PT and some past PT experiences, even some more recent ones, obviously, to try to solve this. So like you said how like something was kind of missing, you know what I mean? Like something's always missing there. So what was missing?
I wasn't feeling good after the PT sessions or therapies. The exercises that they gave me seemed to be irritating or aggravating the symptoms even more.
How many exercises were they having you do?
Well, there was probably a good 10 during the hour session that they told me to do. Yeah. And I didn't see the results from it in the 2 weeks that I was with them. So I knew that wasn't the path to go down.
Yeah. And so, but up to this point, really, right, just to be clear, you were doing the 10 exercises, or I don't know, the sheet of them or whatever, it wasn't really working. And then you really kind of calmed things down, right? And up to this point, you've primarily focused on the walking, right? And so it's not like you've had to do like, I don't know, millions of exercises here.
Right. Exactly.
Like one thing, walking, we'll call it so far.
Basically, yes.
Yeah. Cool. Yeah. And the reason I ask that is that sometimes people think like, okay, well, like, well, how much work is it going to take, right? And like, well, it's way more work to do 10 exercises and drive to somewhere else and then sit there for whatever and be there for an hour than it is to do this, if you ask me. What has been the most valuable thing, right, that has sort of filled in the gap for you out of the program, just high level, for anybody who's like, hey, how is this different? I already tried PT and it didn't work, right? Like, what would you say to that?
Your message of calming the muddy waters and stop poking that angry bear, that was huge. And then realizing that the pain was real, and the pain is pain, and it's always real.
Yep.
And that resonated with me the most, and helped me to go forward. Yeah, just to thank you, Dr. Charlie, and your team for what you've put together in your program, in your GRA program. It has given me the knowledge to realize what this pain is and how to look at it differently. I can't thank you enough for that.
Yeah, pretty eye-opening stuff. Sure. So I appreciate that.
It is for sure. So I thank you.
No problem. Thank you. All right. So hopefully that video was inspiring to you if you're someone who's dealing with, again, spinal stenosis, degeneration, anterolisthesis or spondylolisthesis, right? And you're like, hey man, the only way to solve that is surgery. Not true. We try to fix it with surgery. Guess what happens? People need other surgeries to fix the problems that the first surgeries created. I'm not saying surgery never works or it's never necessary, right? But most of these problems can be resolved naturally with the power of the mind, and movement is medicine. And so Connie talks a lot about how she was able to use some of the mind-based tactics and or strategies and techniques to calm down the sensitivity of her nervous system, to change the way that she views her pain. We call this changing the paradigm inside the program, from one of an old diagnostic paradigm, being sort of caught behind or stuck by this label, right? Feeling like, how am I going to be able to fix that thing which I've been told is wrong with me, right? Charlie, how are you going to be able to fix that thing which is wrong with me? Because you're not going in there and shaving out the arthritis, right? So how are you going to be able to help me? And we were, right? Shifted the paradigm, shifted her worldview, shifted the way that she experienced pain, the way that she viewed it, her relationship with it, and then kept her walking. That's it. All right. She's not even doing any motions yet. She's still got a little bit of the way to go, but really great outcomes for Connie. So if you're interested in getting our help, because maybe you're like Connie, or you feel like you're just stuck by what others have told you is wrong with you, and you want to get past that, you want to move beyond your diagnosis and look for some real solutions and a process that works, check out the link in the description where you can actually apply to chat with us and submit your case for review. I review all cases personally. I actually shoot you a private message, sometimes even call you, not that I should say that, but sometimes even call you and make sure that you know that your case is approved. And obviously if we feel we can't help, well then we'll just tell you. All right, so hopefully that's fair. Let me know your thoughts and comments below. Thanks.